So, I hope you can all see well. So, hello, my name is Reem Daou. I'm a 15-year-old student from Lebanon. And in the 6 months I spent in the Ascent program, I've developed many skills that have helped me on my sub-challenge Future of Medicine, which is shown up here. So here's a solution that I've developed that has been a fruit of my labor and a great start on my journey. So, without further ado, healthcare activities restore health and are saving lives every day. But are we really taking into consideration the waste they generate or its impact on the world? Now, what if I told you that there's a healthcare problem that is crucially impacting our environment, economy, and industry? And what if I told you that this issue has been unnoticed and unprecedented for many, many years? Additionally, what if I told you that every one of you have contributed to this issue before? As per my research, I found that the US Environmental Protection Agency estimates that between 250 million to 1 billion pounds of pharmaceuticals are discarded annually in the US alone. We need to take action to tackle the dramatic increasing amount of pharmaceutical waste worldwide. Now, what is pharmaceutical waste? Pharmaceutical waste are any expired, unused, or unwanted medication that come from healthcare facilities. They originate from healthcare facilities and can be hazardous, such as chemotherapy drugs and radioactive materials, or non-hazardous, such as pills, capsules, and creams. Now, I was able to integrate my learned knowledge about root cause analysis from the core workshops we had in the Ascent program and to reach the second bit of finding the solution for this problem. And I found the following. First of all, when medication is packaged in bulk quantities, patients receive more medication than they actually need. For example, you see this in pharmaceuticals and pharmacies when you get a prescription. So let's say it was a box and a half, which was your prescription, and you're given 2 boxes. This is more than you need. With this extra medicine, you are more likely to be unaware of the proper medication disposal methods, which can pose major negative consequences on the environment and public health. When pharmaceuticals are not disposed of properly, they can end up in the water supply or the environment, and they can contaminate the water or soil and pose a risk to human and wildlife health. Also, the main method of medical waste removal is incineration, which expresses toxic fumes to the atmosphere. Some may think, easy, let's build a sustainable alternative to incineration to fix this problem. Or you may not, but that's what I thought. But with further guidance from my mentor, I realized that I was only solving the byproduct, not the original root of this problem. So this is what I did. Instead, I proposed an electronic prescribing system, and I was able to allocate it these 3 main features. Keep in mind that the last feature here, medication reconciliation, talks about the process of ensuring that patients receive the correct medication at the correct dose at the correct time. These features will then be used to analyze the doctor's prescription of a patient alongside the patient details that were already given, and it will create a comprehensive monthly prescription plan and provide you the exact amount of medication that you need per month. It works alongside a robot to sustainably package the right amount of medicine for each individual. And it's a systemic solution that is comprehensive and a holistic approach to reducing the problem. Now, I was able to utilize organizational skills to create a timeline on how to implement this, which included working with hospitals to integrate this prescribing system and training staff and such. Alongside that, I was also able to, alongside many of the criteria that I considered from an ethical, technical, and logical viewpoint, I think that the most important were compliance with relevant regulations, security and data protection, and interoperability, which are all very important. Then, with all this information, I was able to develop a prototype that showed how this program will work. On the right is the robot's analysis of the data. And as you can see here, so here's the original prescription given by the hospital and by the doctor. And this is the AI's or the program's analysis of this information based on the original patient's credentials and how much it should be taken into consideration. With that in mind, thank you so much. And if you have any questions, please say them, and you can contact me with the further information. Thank you so much.
That was a wonderful presentation, Reem. Thank you, and a very interesting topic. And I think you've really identified a problem there and gone right down to the root cause of it. And I love the way you've come up with that solution. That brings us to the end of the School of Humanity presentation. So I wonder if we have any questions or any feedback or any comments from anybody on the panel. Lots of comments in the chat, people saying, job, very intuitive, never thought about this before. Melissa, you made a comment there as well. I don't know if you'd like to go ahead and say it.
Oh, I was just blown away. I was blown away with all of the presentations, by the way. And Reem, that was awesome. The things that you're thinking about, your ideas, your solutions to the problem. So first of all, yeah, the problem that most people haven't even thought about, but then the solutions that you've come up with are really amazing. And then the way that you presented it, you come across as someone who's had years of experience in the medical industry and in the tech industry. I can't believe you're 15 years old. That's such a fantastic presentation. And I think you should be delivering it to healthcare providers in different countries across the world, and working with governments across the world, and presenting that to healthcare professionals, leaders in healthcare. Amazing. Congratulations. Well done. I'm really looking forward to sharing your YouTube video with lots of my contacts. That was wonderful. Thank you.
Thank you so much, Melissa. I really appreciate that. That's the plan. I plan to share this with a lot of people, and I hope I can make a change.
I really hope you do.
Thanks, everybody, and well done for your presentations today. You've all done an amazing job sharing lots of good tips on how to give the perfect presentation, and then actually having 2 examples of perfect presentations by Reem and Ryan. So thank you very much, everybody. And that brings us to the end of the School of Humanity presentations. Thank you.
Well done, everybody. Thanks so much, Claire, for bringing your students to the Global Innovation Field Trip. It's always enlightening. They've always got new things to talk about, and we very much appreciate that. And Melissa, thank you for your time today hosting. It's very good to see you again. And I hope to see you at the July 22-23 Global Innovation Field Trip as well.
Hopefully. Thank you so much for the opportunity, Julie. It's been wonderful, and I've really enjoyed it, and I've learned a lot. Thank you.
Good job, everybody.
Thanks, everyone, and thanks. It's been a pleasure to be here with Melissa today. Lovely to see you, Melissa.
And you as well,
well done.
Thank you.